excited to be able to do a conversation with the CEO of Access, Carmen Heredia. We're really excited about this. And what we're going to do here today is really just talk with Carmen about some perspectives that she has and some things she would like to share. And then we will have time for questions from you all. But before we kick into that, I wanted to say thank you for the engagement today. I was able to duck into a lot of the sessions and lead one on housing, and I know my colleagues from HMA also were in many of them. Just great discussion, and exactly the kind of thing that I think really benefits us all is when we can engage. It's not just information download, but true interaction and conversation. So I want to thank you all for doing that. I am going to start off with a question, but I wanted to talk a little bit about, I wanted to look back a little bit, and you're not quite a year into your role as the Cabinet Executive Officer at Access. And I'm not going to do the whole what Access stands for, because I do know, but I'm not going to do that. Settling into any role like this is a challenge, and I know you come from the provider community before taking on this role. So I wanted to see if you would reflect a little bit on how your views and perspectives have changed in the, 10 months since you took on this role?
10 months.
10 months, yeah.
10 months. Well, thank you. First of all, thank you for the invitation, and thank you for hosting this. This is my first State of Reform event, and I have found it incredibly inspiring to have this group of people together in an intimate way. I think we see a lot of each other on Zoom, virtually. We're spread out across the state, and what an incredible opportunity to come together and network and think and learn and discuss things. So I'm really looking forward to next year.
I love that.
Already, right? And we've been talking about access all day. I've really found that it's kind of woven into a lot of the sessions. But I'm not even answering your question, which is what have I thought about taking the job? So it has been 10 months. I think I came in from a completely different vantage point and a little bit of a unique way, but very relatable. I have this behavioral health and primary care background, substance use services as well, a career in trying to create access to care in the community. And I've spent a lot of my time trying to learn and listen with stakeholders about areas, especially that I've not been exposed to. I'm not very familiar with HCBS services, for one, or certain parts of the healthcare continuum. We touch so many people in so many different ways. So there's a lot to learn. I've really appreciated how welcoming everybody has been. And inviting me to come out and tour different places, ask questions, dumb questions, starting from scratch over how things work and how, reimbursement and how our policy or, goals, vision setting really affect the community. I've learned a lot. I think when I came into the role, I thought that, I still think, I'm going to change the world. Let's do it, But it's also very humbling to see, how it works on this side, state government and approvals and timing and strategy. So learning a lot from that, angle in a sometimes frustrating way. But I think that it's still an incredible opportunity. I'm really honored to be here, to be in this role. I think that it's something that I think about really often is how not to waste the opportunity. So given that it's slow or difficult, how can I quickly learn how to navigate that so that we can have impact? Our team, myself, the governor's team, the stakeholders in the community, what do we want to get done? They're jobs that, you're not in forever in these positions, and so I really want to make as much impact as possible.
I think that's incredible. I came from a space, I used to work for the National Association of Medicaid Directors, and in that role, I coached and supported and saw a lot of people come in from different parts. no one ever comes into the Medicaid role knowing all of Medicaid, right? That's a lifetime's work, and Vern Smith and others who have been in that space for a lifetime know that it's a lifetime's work and we're never done. So it's really great that you've been able to get so much, and to see it that way as the opportunity, I think, is really key. So still staying a little bit looking backwards, is there anything that's happened in these 10 months that you want to reflect on, either that you feel is sort of rewarding so far? What's giving you some energy from your time so far in the role? Anything that you would want to share in terms of accomplishments so far?
Yeah, the most rewarding thing has been walking into an incredible team and staff that is so dedicated, so committed to the work. Being in state government isn't, the most attractive thing for a lot of folks, right? But the people that are there and that have been there for a while are really committed to what is getting accomplished. And their level of thoughtfulness and attention to the work, it's just so impressive and rewarding. And so rewarding work we've done together, I think, has been the big focus has been the unwinding, right? The unwinding and the planning that went in to prepare for that, and the feedback that we're getting from CMS and from other states over the execution of that. And I just point back to, it's our team members. Our team members studied the policy correctly, interpreted things correctly. There've been some hiccups, but we've handled it gracefully, I think. That has been really rewarding. The other big issue we've been focused on, and you've heard us talk about it, is fraud, waste, and abuse. And I can turn that around to think of it as a rewarding experience in that our team is getting ourselves out of the situation, right? Is correcting, putting a stop to it, correcting it, making sure we don't end up there again.
I believe one of your colleagues said that that's opportunity and recapturing resources that you can use elsewhere when you fix some of those fraud, waste, and abuse problems. So it's not as if it's just a savings, it's really something you can redirect. So an incredibly important issue, so really appreciate that. In terms of, let's look forward. You said you are really looking forward to the opportunity to capture what this is all about and do what you can in the time that you have in the role. So thinking both from, let's start with the upside, the assets that you really see. What do you see as your big horizon issue that you really want to tackle and think you can with what you have and where you are right now?
One issue?
Okay, all right, okay. I'll take as many as you'd like to share.
There's so much to work on. I think I shared with you last night one of the big things that the governor has tasked us with, and part of the platform and the strategic planning that's happening in the state and the initiative going forward. She's challenged us with reducing the uninsured rate to under 5%, which is a big and tall order, and I think it lands squarely in our agency to try to do something about that. Addressing health disparities, that can mean a lot of different things. I think we could do it through coverage, through accessing care, in rural communities, availability of services, accessing. So there's lots of ways to answer that question, but both of those are really, really important big initiatives that we're tasked with. I have all kinds of goals. I think I came into the work thinking about what we could do, and this is going to be further down the line, but in the space of value-based purchasing and outcomes, haven't really gotten a chance to work in that space yet. Elevating the role of community health centers, I think that's really important to me, and I think we could really shift some of that culture in the state to really highlight what they do for our members. So these are lenses I come into the work with, or some of my personal priorities. But at Access, because of the awesome work before me, there's a waiver to implement. There's housing and social determinants of health to address through the housing waiver. There's the pre-release work, which I find really exciting, and we need to do a lot of engagement and pre-work for that, even though it hasn't been fully approved. I think the time is right now that we need to put in that work before it's the pre-work for the pre-release. Then traditional healing for tribal communities, that is super exciting. So these are big initiatives that are going to be really transformative. Of course, mentioning again our time and attention towards correcting the fraud, waste, and abuse, and what that means for behavioral health and that service delivery system, and how to reward good actors and make the services sustainable again, so we're not in this situation, and how that plays into tribal communities, you know, and that circles back to disparities. So there's lots to do. I really couldn't tell you one thing.
So can I ask a little bit, going a little deeper on both the housing, supportive housing waiver and the pre-release waiver? What's the timelines that you're looking at in terms of those rolling out? Are they in the same bucket? Are there relationships between the two? How are you looking at those two initiatives and the timing that's coming for those?
Yeah, we're still negotiating the pre-release CMS, so
Okay.
I don't think we have a clear sense of a timeline there. They're working in order. My impression is that it's traditional healing will be approved first, followed by pre-release.
Okay.
For HTO, it's a much more clear timeline because that did get approved, and now we're in the process of preparing for implementation, and we're set to go live October of next year.
That's great. That's great. So with all of those opportunities, what do you see as your biggest barrier, biggest challenge area right now in terms of right in front of you? What are you worried about?
Right in front of me this week, we've been talking a lot about budget. So our state is currently in a state of deficit, about $850 million in deficit. And so we really, anything we plan and dream up and want to solve, everything relates to money. And so prioritizing what you work on, how you work on it, how to time things. We're going to hear back on everything that we requested in the initiatives that we proposed to the executive branch, what that'll look like, and then we'll see how it plays out with the legislature.
That's great. So before I turn to the room to see if they have questions, what do you need from the community? What are you looking for the most in terms of the industry partners, the community partners that you need to be successful? What do you need from folks right now?
I think that because I'm meeting a lot of new people, sometimes I've been surprised with maybe the lack of knowledge and information that there is about very old and existing things that are in place. For example, the crisis system is incredible in Arizona. We know all about it probably in this room. But as you meet with other players, they might be completely unaware and might be starting a new project completely from scratch. And we're like, what are you doing? Hold on, we need to catch you up. And so I think of that in terms of leveraging very experienced people that have seen iterations of history happen in Arizona, help explain that and pass that on to newer generations or new people that have come into the market. I think I'm seeing a lot of opportunities and could ask for that help in terms of help me explain what we have in place with the crisis system, with what's another example? I'm thinking of that right now as it comes to mind. And there are other examples though of well-established delivery systems or programs that we constantly need to educate the legislature or again new players.
Well, you brought up the L word, so the legislature will meet again in the next few months. Anything that you see on that agenda that you could again use the support of partners in working through with the legislature?
Yeah, there's going to be a big push to reform licensing when it comes to behavioral health. I think that that could look a lot of different ways, and it'll probably get changed over time. So input and advocacy around that. And in addition to that, really trying to carve out whatever is possible, again, with the budget in terms of funding the workforce, the healthcare workforce, and behavioral health, and areas in the system we need to strengthen. So definitely call upon folks in this room for that kind of help.
And I certainly heard a number of efforts. I know we talked about workforce today in several sessions. We've talked about what's possible. We talked a little last night about some of those issues. So clearly that's going to be a place to go. So I'm going to open it up for folks to raise things that you heard about today, any questions that you have. And oh, I see a question in the back of the room. Robin?
Good afternoon. So my question is about a little bit about the workforce challenges, but more along the lines of Access's position on technology and how technology can augment service delivery, and how Access might be thinking about use of enhancements around technology and, dare I say, AI, for purposes of supplementing and supporting interventions, and what might be necessary for the associate reimbursement for some of those things. Because there are some challenges in terms of people using devices and so forth that might be helping people self-regulate, but in terms of the activities associated with introducing those, practitioners aren't necessarily compensated, if you will, for certain facets of the work that they do in concert with that technology to also keep that person stable. So really just want to hear a little bit about if there's folks at Access thinking about technology as it relates to any of the service delivery pieces.
It's not an immediate conversation we've had, but I do know that in states across the country, it's a conversation that's starting to happen. There were some sessions, at conferences we went to recently. So I think that we maybe are getting slow to get on that topic, but in general, I think I'm open to learning about it. I think we probably have to be very careful with policy we set and think of long-term, impact to the system and what that would mean for different populations. And I'm sure there's a space and a way to leverage technology in a way that will help with workforce issues. So I think that could be the great advantage there in small ways and big ways. You don't want to completely replace services or end up in a position where all notes are auto-generated, things like that when it comes to documentation. So I immediately think of places we don't want to end up to.
Mm-hmm. Yeah, I think it is a conversation everywhere, but it certainly is something that I know earlier we were talking about telehealth and that you all have kept that in place and supported that, but this is something more that Robin's talking about too. So
a whole nother level.
Yeah, absolutely. So, but fascinating.
A direct conversation we were having with other Medicaid directors on that was how AI might be used for RFP responses and how to kind of watch out for that. So it could come in a lot of different forms.
We'll talk to the college professors about plagiarism and see if we can handle that. Other questions, thoughts? Yeah, I got Vern up here.
Hi, Vern Smith. So you mentioned the governor had given you a goal of 5% uninsurance rate. I have to say, no one is ever challenged by incremental goals. We're challenged by big, bad, bold, meaningful, audacious goals. This is one. And I'm just wondering if you could say a little bit more about what your thinking might be about how Access might contribute to achieving that goal in Arizona.
Well, it relates to funding again in terms of what's available to be done right away. I feel like the administration is very much about coverage for all. So how to get there and how to do it in small chunks, that's the path, right? We're doing road mapping sessions to try to see what those incremental bite-sized pieces might be, how to leverage, benefits to cover some of the services if it's not direct coverage, but it's through a benefit. So some interesting conversations. specific to dental services, for example, how to cover, a specific service, not just the entire medical benefit. But that is the specific, audacious, big, hairy goal, and I think that the deadline's 2030, so we have a little bit of time there.
That's great. As I look for a couple other questions, I'm going to ask you. You mentioned in your your history and your personal passion, behavioral health and substance use disorder. What do you have on your? Do you have a goal around that, or particular areas of focus for you in that space right now?
I think that the number of deaths we're seeing, with the fentanyl crisis, we could do more work. We need to work more closely with our justice partners on that issue too, and what it means to come out of an institution and be reintroduced to street drugs. I heard from Pima County that they're seeing a drastic increase in deaths and just very concerning things. And so how do we put that level of response there and available, make sure we touch everyone we can. I think for that specific issue, that's why I'm so excited about pre-release services and being able to augment what that looks like. And the session today was fabulous. So the people, I don't know if they're still in the room, but met some great folks from Maricopa County. And then behavioral health, I come from that community, I come from that background, and so very near and dear that, and a good understanding of how it's hard to have a sustainable operation, how to ensure that the workforce stays, that recruitment, retention, the level of burnout. So how to support these services, because they're so important for us, and the need is only growing. I mean, if we had all the money in the world, I would invest it in key areas, and I think that the larger administration is taking that approach as well. So I think, this next year sounds like a challenge, but we're definitely pointed in that, especially from what the state's been through. And again, that notion of rewarding good providers, compliant providers that know what they're doing, that have been doing it for a long time and know how to do medical billing in a way that, is correct and then is really serving the patients. I think that's setting a low standard in terms of let's start with that, let's reward that. And then you have so much to tackle in terms of, we're evaluating levels of care and what might be missing to avoid psychiatric hospitalization. And do we need to fund recovery homes? So there's lots to work on.
That's great. There we go. I got one. Of course.
Jim Hammond with the Hertel Report and Professional Healthcare Solutions. Carmen, thank you very much for being here. Kathleen, thanks for a great day. You talked about the tribal traditional healing. Are there any other cultural special areas that maybe need some attention? Tribal care is getting a lot of attention lately, but there are other kind of subcategories that we could go and try to find if we're meeting their needs. Are there any other cultural areas that we could work on?
That's a great question. I think that, we're working on what's right in front of us and what's been requested, especially by that previous administration, and very excited about that, and we're going to learn a lot from it. One of the things we're doing at Access is recruiting a chief equity officer. We're calling it a chief engagement officer. I hope that person in that role will help guide us with data, with engagement in the community too, on understanding where some of those opportunities might be. And I think if we accomplish traditional healing successfully, that's kind of the very next question is what can we do? I come from, if you know a little bit of my history, it was a Latino-focused serving organization that I spent a lot of my time in. And, you know, there's a lot we could do for that community. I think that there's a lot when it comes to just translating information we put out, how we serve the community, and that's just one that I could speak to, but that there's a whole gamut of and when we talk about addressing disparities, that access and what prevents access, what prevents culturally maybe someone from coming in for service.
Good, thank you.
Well, do I see any more burning questions? I have one last one that I'm going to ask you in terms of, you started by talking about FQHCs and community health center engagement and bringing them, growing that space. Talk just for a minute, I know that's where one of the places you've been coming from. Talk a little bit about what you see that looking like. How do you want to move that field forward?
Well, I really admire that health centers have a lot of data. They have a lot of resources. I mean, that comes in different shapes and sizes. But I think we, in this state, can do a better job of acknowledging that work that's there, partnering with them more. They're incentivized to serve Medicaid, and I think Medicaid needs to understand that and needs to partner with them side by side. I need to more clearly give that message even internally at the organization. I haven't been as clear as I am with this group, so you're getting a primer. But then just what that could look like going forward. I think our federal partners, I had a great conversation with the regional director, Reynoso, today about this very topic, and they recognize, I mean, they are federal clinics, safety net, touch points, and across the whole state and in rural communities. And so when we try to tackle disparities and what's available to us right now, it's that network that's out there in all these communities. So that's maybe a vague answer to your question, but I think it's working more closely with them and partnering and really seeing them as an important player in the system.
Great. Oh, that was the perfect applause line, right? I really want to thank you for sharing your perspectives here today. It's been really helpful, and I think a good capstone to our conversations. You've been able to bring a lot of them forward and circle them. I want to thank our sponsors for their support for this meeting. I want to thank the State of Reform team, including Kaylor and Ethan, Eli, and Heather, who have been on site, and our great AV team who have helped us through today and sat in quite possibly the coldest room in all of Arizona for the entire day. So thank you so much for coming. Thank you for coming in here and joining us for this closing. And then I do hope you will join us for the reception. And thank me again. Help me thank CEO Heredia for her time today.
Thank you. Thanks for sticking it out for the last.
Thanks, everybody, and safe trip home.